So emergency contraception is contraception that a woman would use after she's had unprotected sex. There are three main types of emergency contraception. Two are contraceptive pills. We have the one that most people are familiar with, which is a levonorgestrel based contraceptive pill, quite a high dose that can be just bought from a pharmacist. We have Ella-1 or ulipristal, which is a newer type of emergency contraceptive pill, which can also be obtained on prescription from the pharmacist. And we have the Copper IUD. The Copper IUD is an intrauterine device that can be placed inside the uterus to prevent implantation of a fertilized embryo. Well, the non-hormonal copper IUD is far more effective as an emergency contraception. It is 99.2% reliable at preventing a pregnancy if inserted up to 5 days after unprotected sex. This is far superior to the emergency contraceptive pills, which decline in their efficacy and are very dependent on the time in the cycle that the woman has unprotected sex. So the copper IUD is far more reliable. The other advantage about having a copper IUD for emergency contraception is that once it's placed, it can then be used for her ongoing long-term contraception. And we have 5-year devices and 10-year devices, so it can provide very cost-effective and long-acting effective contraception. To have an IUD inserted, you would require, first of all, a consultation with the doctor right before the procedure. And if suitable, then it's a bit like having an extended crampy pap smear. So what we would do during the process is to insert a speculum into the vagina. We then have to, after some cleaning, measure the inside of the uterus to see how big your uterus is. And then once we know how big the uterus is, then insert the IUD. So some women will find it daunting and they might find it uncomfortable during the procedure. To get around this, if we have time to organise it, we can offer an insertion under intravenous twilight sedation. If we do not have the time to be able to organise placing a woman on our theatre list, then we could offer analgesia beforehand in the form of oral analgesia, but also an inhaled painkiller that also relaxes women called Penthrox. Well, both of the emergency contraceptive pills are a lot less effective than the copper intrauterine device. Taken early enough, they can be quite effective if a woman hasn't already ovulated. The Levo-N can be taken up to 3 days after unprotected sex, and the ulipristal can be taken up to 5 days after unprotected sex. But we still tend to see quite a lot of contraceptive failures with the contraceptive pills, so we would always recommend, if the woman has the choice, that she choose to have a non-hormonal copper IUD inserted.